Hey Sebbies, Seborrhoeic is back. I do hope you all are doing well. So in today's video, I'm going to be exploring the differences and similarities between dry scalp and dandruff. Are they the same thing? Are they different? Are their symptoms the same? Like, what's up with that? And what about seborrheic dermatitis? I've heard a lot of people talking about this as well. Does it apply to me? What is seborrheic dermatitis? If you are interested in learning about these different scalp conditions, stay tuned. Alright, so of course I had to do my due diligence in researching these various terms, and we're going to start out real simple. One of the reasons why I wanted to do this video was because I have already made a couple of videos that will be coming out very soon. It's a two-part series and it's titled How Often to Wash Your Dreads. In those videos you're going to hear these three terms thrown around: dry scalp, dandruff, seborrheic dermatitis. And so I want to make sure that you know exactly what each term refers to. What is each term, so that you will better understand what I'm trying to communicate to you in that two-part series. Alright, so as I said, let's start out real simple. So we look up dandruff, it's a noun, and it just says small pieces of dead skin in a person's hair. Alright, cool. You know, keep it nice and simple. Keep it simple, stupid, KISS method, right? But for a bit more involved definition, we can go to Wikipedia. Okay, and it says dandruff is a skin condition that affects mainly the scalp. Symptoms include flaking and sometimes mild itchiness. It can result in social or self-esteem problems. A more severe form of the condition, which includes inflammation of the skin, is known as seborrheic dermatitis. And so there we have it. That is the link, that is the connection between dandruff and seborrheic dermatitis. Dandruff is a form of seborrheic dermatitis. It's a much milder form, and it's a form that does not have the associated inflammation. Okay? We'll get more into seborrheic dermatitis a little bit later, but just wanted to note that so that it sticks. The cause is unclear, but believed to involve a number of genetic and environmental factors. The condition may worsen in the winter. It is not due to poor hygiene. The underlying mechanism involves the overgrowth of skin cells. Diagnosis is based on symptoms. There is no known cure. The typical treatment is with antifungal cream such as ketoconazole. Dandruff affects about half of adults. Onset is usually at puberty. Males are often more affected than females, of course we are. Rates decrease after the age of 50. Okay, so that is Wikipedia's definition of dandruff. Some things I want to highlight: it's not due to poor hygiene. Okay, so if you see someone with dandruff, or if you are experiencing, you know that you have good hygiene, so you already know it's not due to poor hygiene. But if you see some other poor lads suffering with it, you know it's not that they're just nasty, right? It's not due to poor hygiene. They can't help it. And I also want to highlight the fact that with dandruff, there is no inflammation. Okay, it's a milder form of seborrheic dermatitis. Now, let's immediately go to Wikipedia's definition of seborrheic dermatitis. Seborrheic dermatitis, also known as seborrhea, is a long-term skin disorder. Symptoms include red, scaly, greasy, itchy, and inflamed skin. Why? Because that inflammation is present with seborrheic dermatitis. Areas of the skin rich in oil-producing glands are often affected, including the scalp, face, and chest. It can result in social or self-esteem problems, I bet. In babies, when the scalp is primarily involved, it is called cradle cap. So you guys have heard of that, and if you have younger siblings or whatever, you might have actually witnessed that. Dandruff is a milder form of the condition without associated inflammation. So once again, I want to drill this into your head, okay? Dandruff is a form of seborrheic dermatitis. except there is no inflammation. Okay, it's a milder form of seborrheic dermatitis. The cause is unclear but believed to involve a number of genetic and environmental factors. Risk factors include poor immune function, Parkinson's disease, epilepsy, and Down syndrome. The condition may worsen with stress or during the winter. It is not a result of poor hygiene. Diagnosis is typically based on the symptoms. Now you might be wondering why a lot of that seemed to be a repeat of what I read for dandruff. Well, don't forget that dandruff is a form of seborrheic dermatitis, right? So of course there will be overlap. The typical treatment is antifungal cream and anti-inflammatory agents. So now they tackle on the anti-inflammatory agents because remember with seborrheic dermatitis, you have inflammation involved. Specifically, ketoconazole and cyclopyrox are effective. It is unclear if other antifungals, such as miconazole, are equally effective as they have been poorly studied. We need some more research, people. Other options may include coal tar and phototherapy. The condition is most common in those around the age of 50, during puberty, and among those less than 3 months old. In adults, about 2% of people are affected. Males are often more affected than females, of course. Up to 40% of babies may be affected to some degree. Okay, so now you understand what dandruff is. You understand that dandruff is a milder version of seborrheic dermatitis. So now you have a better understanding of what specifically seborrheic dermatitis is. So now let's go and look at the difference between dandruff, which is a milder form of seborrheic dermatitis, and dry scalp. And to do this, I found a page at diffin.com, okay? And there is this page titled Dandruff versus Dry Scalp. So let's first look at the comparison chart. We have a column for dandruff and we have a column for the dry scalp. You have the ICD-9 classification as well as the diseases DB classification, but we're not really interested in that, right? Let's go down to the definitions. So the definition for dandruff, it says dandruff, also called scurf and historically termed pityriasis capitis, is the excessive shedding of dead skin cells from the scalp. Dandruff can also be caused by frequent exposure to extreme heat and cold. Dry scalp. Dryness in the scalp can also cause itching that leads to flakes of skin that are white in color and fall off in small pieces. And it's important to note that the pieces that fall off from the scratching that you do because your scalp is itching because it's dry, you know, it's a result of dry scalp, those pieces are small, okay? That's very important. Remember, it's going to be one of the ways that you can determine whether or not the flaking that you see is from dry scalp or whether it's actually dandruff. So let's get down to the section symptoms of dandruff versus dry scalp. Dandruff and dry scalp have similar symptoms, okay? Symptoms of dandruff. The cause of an itchy scalp may be dandruff, which is white or gray visible flakes falling off the head. The hair may be oily, but still the flakes of skin keep falling from the head. They can sometimes be as large as 1/4 inch and have an oily feel to them. Another symptom of dandruff can be redness in scalp or irritation that does not go away after a simple washing. Okay, so the flakes of skin will sometimes be oily. They can be as large as 1/4 inch and they have, you know, the oily feel to them. So remember I told you with the dry scalp, the pieces that fall off the flakes will be small, right? That's not necessarily the case for dandruff. And there will be an oiliness in terms of the texture associated with dandruff. Dry scalp. Dryness in the scalp can also cause itching. Dry scalp leads to flakes of skin that are white in color and fall off in small pieces. This is usually accompanied by dryness on the rest of the body. So another clue that what you're contending with is not dandruff, but rather a dry scalp is that you're dry all over your body, right? Not just on your scalp. Now let's get to causes of dandruff and dry scalp. Causes of dandruff. For people with dandruff, skin cells may mature and be shed in 2 to 7 days, as opposed to around a month in people without dandruff. The result is that dead skin cells are shed in large, oily clumps, which appear as white or grayish patches on the scalp, skin, and clothes. So there you go. Once again, the difference is the size, and also with dandruff, there is that oily feel to them. And some people, their skin cells mature in about a month's time and then are shed, right? But in certain other people, skin cells may mature and be shed in 2 to 7 days. So if that's happening, if that process is happening that much more frequently, then yeah, you can definitely see why, you know, people are flaking up like crazy, right? Dandruff is the result of 3 required factors. 1, skin oil, commonly referred to as sebum or sebaceous secretions. 2, the metabolic byproducts of skin microorganisms, most specifically Malassezia yeasts. And 3, individual susceptibility. Common odor literature cites the fungus Malassezia furfur, previously known as Pterosporum ovale, sounds like Latin to me, as the cause of dandruff. While this fungus is found naturally on the skin surface of both healthy people and those with dandruff, it was later discovered that a scalp-specific fungus, Malassezia globosa, is the responsible agent. Rarely, dandruff can be a manifestation of an allergic reaction to chemicals in hair, gels, sprays, hair oils, or sometimes even dandruff medications like ketoconazole. There is also some evidence that food, especially sugar and yeast, excessive perspiration, and climate have significant roles in the pathogenesis of dandruff. Okay? Pathogenesis is basically how a disease comes about. Causes of dry scalp: an alternation in temperature or humidity. So kind of going back and forth between two things. Alternation in temperature or humidity causes dry scalp. For instance, in the winter, when the heater is on, the scalp is exposed to a drier environment, and the result is peeling and flaking. Now, let's get to some treatment. Treatment for dandruff versus dry scalp. Dandruff treatment. Anti-dandruff shampoos use a combination of ingredients to control dandruff. Salicylic acid used in Seborrheic removes dead skin cells from the scalp and decreases the rate at which these cells are created. Zinc pyrithione kills Pterospora, the fungus responsible for dandruff. Selenium sulfide or ketoconazole achieves the results of both salicylic acid and zinc pyrithione. Now to treat dry scalp. The easiest and most effective way of treating dry scalp is by having lots of water to rehydrate your scalp. Natural oils in the hair should be allowed to regenerate by avoiding regular hair wash. A hair oil or a leave-in conditioning treatment will let the body adjust to the new level of humidity in a few days, and the scalp will return to normal. Okay? So there you have it. So with dandruff treatment, they have anti-dandruff shampoos that have certain things in them that are used to remove dead skin cells, right? They also have certain other things like the zinc pyrithione, which kills the fungus responsible for dandruff. And so that is the treatment for dandruff a lot of times. However, with dry scalp, it's a much easier fix, right? You don't need to go to the doctor for dry scalp. One, you need to stay hydrated, okay? And then it also mentions using natural oils. Natural oils in the hair should be allowed to regenerate by avoiding regular hair wash. And then I would also say you can use whatever oils you normally use to combat a dry scalp, right? For me, it's been a while since I've used it, but I like castor oil, or Jamaican black castor oil. I think I prefer regular castor oil because it's not quite as thick. In previous winters, I've used that during the winter, and it's helped. And then it says a hair oil or a leave-in conditioning treatment will let the body adjust to the new level of humidity in a few days, and the scalp will return to normal. So I would probably, instead of the conditioning treatment, you know, a leave-in conditioning treatment, I would probably use oils to achieve that. But yeah, I mean, you know, the choice is yours. So hopefully you guys now understand the difference between dandruff and dry scalp, and you understand the relationship between dandruff and seborrheic dermatitis. You understand now that dandruff is a milder version of seborrheic dermatitis that does not involve inflammation. Okay? Hopefully this video was enlightening, and hopefully you will use the knowledge that I supplied you with, if you didn't already have it, to better understand the two-part series that will be coming very soon. The first installment will happen this Friday, so stay tuned for that. As always, please learn to love unconditionally, because loving with conditions conditions the heart to not really love at all. Seborrheic is out.